And so to begin my critique, I am gonna start off with reading the drug knowledge. So the medication that I'll be administering is cefazolin. The classification is a therapeutic anti-infective. Also, the classification is a pharmacologic, and its first generation cephalosporin. The onset is rapid. The peak is 5 minutes. The duration is 6 to 12 hours. The dosage range is 500 milligrams to 2 grams every 6 to 8 hours, and the max is 12 grams per day. This medication is an antibiotic. It's used to treat a wide variety of bacterial infections. It works by stopping the growth of bacteria, and it's usually given to patients with some type of surgery that underwent some type of surgery. So some of the implications to consider prior and after administration is to assess for infection. So you want to assess the patient for any signs of infection. You want to assess for the vital signs, appearance of the wound, spectrum, urine, and stool, and the white blood cell count. Also, what you want to observe if the patient has any allergic reactions or any allergies, and have some type of medication at the side, so just in case the patient does have an allergic reaction to the medication. Some side effects that you might see with this drug will be diarrhea, stomach pain, stomach cramps, nausea, vomiting, loss of appetite, or skin rash or itching. So that will be my medication knowledge. After doing that, I'll then go on to read 2 important factors of the medication policy for administration of IV medication. So I'll read about the compatibility of the solutions. So if the combination is listed as incompatible, then the medication must be administered at separate sites, or the IV line must be flushed with a compatible solution between the administrations of each medication. If the combination is not listed as being either compatible or incompatible, then the medication should be treated as incompatible until additional information from additional sources is obtained. So after reading my medication policy, I'm then going to take my worksheet. I'm going to open the patient's chart. So it says right here that it's Sid Garland. So right, Sid Garland. The date of birth is 11/08/1965, 11/08/1965. He lives with penicillin codeine. He has a full code. He is administered into the hospital due to below the knee amputation of his left leg. And yes, it's penicillin, codeine, allergies, and his status is full code. So he did state that he does have pain, which is 7 out of 10, so I'll write that here. Then his vital signs, his temperature is 38.5. His pulse reading is 110. His respiratory is 18. And his blood pressure is 120/75. His oxygen is 98% at room temperature. Okay, so after reading that about my patient's chart, I'm then going to go ahead and look at his lab values. So I see here that he has a high white blood cell count. I see that it's 25.7, and the reference is 4.0 to 11.0. Then I'm also going to check the wound culture. So I see that first wound culture, the antibiotics, the cefazolin is 6, and there's no interpretation. Okay, so after checking that, I'm then going to sign off. So it says on the print my full name, Kellyanne Bell, and I'm a registered practical nursing student. Signature, and my initial is KB. I wonder if you can see that. Okay, so after checking, signing off on the signature, signing off on the signature sheet, I'm then going to compare my doctor's orders to my MAR. So it says Sid Garland, MRI number is 344316, 344316. Date of birth is 11/08/1965, 11/08/1965. Says here he's allergic to penicillin and codeine. Says here he's allergic to codeine and penicillin. The medication that I'll be administering is efaxazolin. Efaxazolin is the medication here. The dose is 500 milligrams. 500 milligrams. The route is IV. IV is the route on the doctor's orders. Says the frequency is every 8 hours. Says here in the doctor's order every 8 hours. Special instruction says that it's times 7 days, and here in the doctor's order it says times 7 days. And I'll be giving this medication at 6 a.m. in the site of the IV site, which is going to be on my patient's left hand. And the reason I'm giving this medication is due to Sid having knee amputation in his left leg, and this medication is used to prevent any infection or any bacteria. And before put away my my doctor's orders, it says that the IVs started at with normal saline at 125 milliliters per hour. So that's going to be the main line. So after that, put away my doctor's orders, and then I'm going to go to my monograph. So my monograph says for IV mini bag that to dilute in 50 to 100 milliliters of IV solution and infuse over 10 to 60 minutes. So the infusion time that I was selected and I'll be administering it is 45 minutes. So, and I know that falls into the correct rate because it's 10 to 60 minutes that I can infuse this medication. Infuse the IV mini bag, sorry. So then going on to compatibility. So normal saline I see that it is compatible with the medication that I'll be administering, which is the efaxazolin. For my compatibility check, I know that there's no medication to medication incompatibility due to the main line just being run by normal saline, and I know normal saline is compatible with my medication, which is efaxazolin. And then I know that for the dilutant and my medication, it's safe, and there's no incompatibility because normal saline is compatible with which the dilute is normal saline, and which is compatible with the medication that I'll be administering, which is efaxazolin. And I know that there is no incompatibility with the main line because the main line, what's running in the main line is normal saline, and normal saline once again is compatible with efaxazolin, which is the medication that I'll be administering. So after checking that and checking my monograph, I am then gonna go over to my patient's line. I hope you can see here. Could you see? So over here, okay, so I'm over at my patient's bedside. So I'm gonna wash my hands, and okay. So after washing my hands, I'm coming over to check the main line. So I do want to check that it's the right medication. So it says normal saline, so it's normal saline, and that the expiry date is December 20th. So December 20th here, and that the rate is running at 125 milliliters per hour. And I see that it's dated. And I'm just checking to make sure that it's running smoothly. The clamp is open. And then I'm gonna go ahead to my patient right here. My patient that is right here, and I'm just gonna go ahead and check the site just to make sure that there's no inflammation, edema, swelling, or tenderness, and that the skin is warm, or any warmness, anything of that sort. And then I'm gonna go ahead and do my pre-assessment. So my pre-assessment would be to check the wound, just to make sure that there is not any infection at the site, and just to make sure to double check. I'm gonna ask my patient if he's allergic to anything, and he's gonna tell me he's allergic to penicillin and chloride, and then I'm gonna go ahead, go back. So they're doing that now. Okay. So after checking that, I am then going to, come on. I am then going to select I'm going to wash my hands, and then I'm going to select my correct drug, medication, and then I'm just going to analyze my bag, make sure that there's clarity in my bag, and that there's no cloudiness, and there's no leakage. And then I'm going to check for expiry date. So expiry date is August 28th, and then on the bag it says January 21st. Alright, so after doing that, I'm then going to do my first check. So with the medication to the MAR, and it says Sid Garland. The medication I'll be administering is Ceftaxazolin. The dose is 500 milligrams. The rate is IV, and it says frequencies every 8 hours. I'll be administering this medication at 6 a.m. in the site of the patient's left hand, at the IV site. And the reason I'm administering this medication is due to Sid Garland having surgery in his left leg, being amputated, and this medication is to treat any bacteria or any infection. Okay, so then I'm going to go ahead and do my second check. It says Sid Garland medication. Medication is Ceftaxazolin. The dose is 500 milligrams. So 500 milligrams. The route is IV. Frequencies every 8 hours. So every 8 hours, I'll be giving this medication at 6 a.m. in the site of the left hand. And the reason I'm administering this medication is due to Sid Garland having surgery in his left leg, and in his left leg. And this medication is to prevent any bacteria or any infection. After doing that, I'm then gonna get my blank paper. So my blank sheet. So I'm just gonna stop this.